with Rachel Beech. Rachel, welcome.
Thank you.
You did a very interesting talk. You talked about nursing on thin ice.
Yes.
Okay. Well, let's start talking about where you're from. I hear you hail from Northland.
Yes, I work for the Northland District Health Board, and up there I run our regional detoxification service called Timatanga Ho, which means new beginnings.
Awesome. Cool.
So my background, I've worked for alcohol and drug services for many years, probably about 20 years now after being a new grad nurse, working in Pitman House in Auckland. Moved to Northland about 12 years ago and did varied roles until we opened our detox unit 8 years ago. We're in our 9th year now. So and I put that together and support that now.
And your unit yourself is based in Dargaville, isn't it?
Yes, it's based in Dargaville Hospital, yes.
Right. And so what was your talk about today?
It was about the immense problem that we have with methamphetamine. So Northland being such a rural and remote area, we know that the prevalence of our methamphetamine use up there is extremely high. So the government awarded us $3 million to be shared between us and the police. So health and justice coming together and looking at ways of being able to manage and reduce this problem for Northland.
That's fantastic.
Yeah.
That's a good initiative.
Yeah.
And so methamphetamine, I just want to clarify, we've got amphetamine and methamphetamine, is that right?
Yes.
And the difference is basically a methyl group.
It is a methyl group that's added to the amphetamine in the production when it's getting made. The thing with the methanol group though is it intensifies the amphetamine base. So not only is it stronger, but it lasts longer. You have a quicker high from it. So the dopamine release from that is immense, which is obviously why people use it. You know, it makes them feel good.
So adding this methyl group makes things more potent, more addictive. Okay.
Yes.
Would you say it's more addictive than food and lifestyles and that kind of thing?
Absolutely.
Yeah.
When we look at the dopamine release, you know, we get joy out of food, sex, and they've even measured it against cocaine, and methamphetamine is 3 times more likely to increase dopamine levels to about 1,200 in your brain. So that the impact of that is immense for people, you know.
And so in your field, what's the health impacts been that you've seen through using methamphetamine?
Yeah. I mean, there's lots of health impacts on the individual. The individual's health in general is extremely impacted through their lack of sleep, through their lack of nutrition, self-cares, if they're injecting. So there's different ways of using methamphetamine. So with that, the route of ingestion also brings problems as well. So we're seeing quite a lot of abscesses from injections. So personal, everyday day-to-day cares completely miss out whilst this person's intoxicated. Yeah.
So what do you do up in Dargaville with your detox unit?
So our detox unit, we have 5 beds in the detox unit at the moment. However, that is increasing. And we will admit people, so over the first couple of days it's really about that crash phase. So depending on how much people have used to the impact that the meth has had on them, they could sleep pretty much for 3 days to sleep that off. As nurses, of course, we're in there waking them and making sure that we're feeding them, they get their fluids, and then pretty much we're leaving them to sleep in that first phase. It goes on to then, once they're active again, there's immense cravings, and sort of how to manage those cravings in that unit. When it's driving them, it's making them really restless, it's making them quite agitated. They find it very difficult to get any joy out of anything. So for them, they're kind of pacing the halls, not worrying, thinking to themselves, I'm bored, what is there to do? And so it's been able to be part of that process, keep them engaged in treatment is the key for us, really. So at that time we would use maybe some diazepam or something to help mediate what they're feeling internally. If people are suffering from psychosis, which most people know that can be part of the presentation for a methamphetamine user, we can use some antipsychotics to help with that too. And primarily getting that sleeping pattern back to where it needs to be, so and for that future.
Okay. And so the withdrawal process, it takes a wee while. Does it intensify and then get better, or what does the pattern show?
It fluctuates. So that first initial phase, so people are with us 2 weeks, that's the intense phase. However, some of those symptoms, of course, take some time to kind of sort through. We call them prolonged. So especially sleep patterns, anhedonia, where they're not getting any joy out of anything anymore, and some of those things where our community team will help and keep supporting people to engage in treatment. They're using a matrix model that's keeping people engaged in treatment for 16 weeks, every day focused on something to do with their recovery.
Okay. By anhedonia, no pleasure because you've used up all your resources from the dopamine release from the methamphetamine in the first place.
Exactly,
Okay.
yes.
And I was going to ask about, there was something you touched on about the wastewater in Northland. There was something that came out recently about, in Whangarei in particular, was how much P was being measured in the wastewater.
That's right. So with our the project that we're piloting up there, Te Ara Oranga, part of that project allowed some money to go into our wastewater testing. So what they've found in Whangarei alone, that they're estimating the cost of methamphetamine use is costing Whangarei $17 million per annum for how much people use. And it was quite interesting to measure it against the results that they were actually getting over the country. In Northland is extremely high, the highest for methamphetamine use.
What were they hoping for?
I don't think they actually really knew, and so this was a platform for somewhere to start, and a lot of the statistics that we already have, they've not really been quite confirmed around how much methamphetamines are getting used, not only in Auckland but in New Zealand alone, and the idea is that we're all underestimating exactly how many people are using.
Thanks so much for coming along and having a chat with us, Rachel.
That's not a problem. Thank you for asking me.
Awesome, thank you.